They say when you expect less, you will appreciate more. However, life is full of expectations. Today, I'm Dr. Reshma and I'm with Dr. Srinath Kumar T.S.
Hi.
He is head of emergency department here in NH Bangalore. We are here to make you understand what to expect when you come to emergency department. Hello, sir.
Hi Reshma, how are you?
I'm fine, sir.
Very nice.
So first of all, sir, emergency department is known by many names.
Yeah.
Casualty ward, A&E. What do you prefer and why?
See, what happened was hundreds of years back, they didn't know what is the term emergency department. So it all started by the misnomenclature, that's what I would like to say, as a casualty. Casualty means, as the name suggests, there is some kind of a mishap which has happened and it is a low grade treatment, as we all know.
Yeah.
Casual care. So then came a total change when there were number of more war crimes, accidents, everything came into picture. So that time it became accident and emergency wards. Now, past 40 to 50 years, the healthcare providers came to know that no, this is a separate department which has to have its own healthcare providers, both doctors, nurses, paramedics, everybody. And then the nomenclature changed as emergency department, which is currently the worldwide recognized.
Okay, so it is emergency department.
Yes.
Okay, then who are all the patients that should come to emergency?
Anybody who is having in any kind of an emergency, they have to visit an emergency department. And we all know that the OPD hours is a fixed time, but emergency is not like that. And you say that every second counts. Where does every second count? That's in the emergency department. Say a patient is having stroke. We all know what is stroke. Chest pain, patient with high blood pressures, low sugars, abdominal pain, anything where there is a blood in the urine, or he has a severe micturition issues, or he has a swollen leg, or there is a missed beat, or he feels a palpitations. So these are the patients who come usually to the emergency department. Along with them, we know now and then there is fever, high-grade fevers, which also come into picture. And also, we know COVID has changed the whole morphology, and the importance of emergency departments came into vogue.
And anything if you have taken medication and it doesn't come down?
Yes, like a poisoning patient, let it be. In our country, we all know organophosphorus compound poisoning is still commonest. Then tablet overdoses, any other kind of an poisoning which needs an immediate care, they also come into picture. Or snake bites, they come into emergency departments. Anybody within off hours having some issue, they always approach the emergency department.
So why will a hospital require an emergency department?
So you see, when a patient comes into the hospital with any kind of a acute illness, he will not be aware where to go. And this is the best place. Say, I'll give you an example. If some patient has high blood sugars along with his altered mental status, he is coming into the hospital. So he'll be directed towards emergency department. So to treat a high blood sugar, we need an endocrinologist support. To intubate a patient, you require an anesthetist. You to give appropriate amount of fluids and put in a central line, you need an intensivist. And then to look into the overall system, you may require a general physician also. But everything put together, you have to resuscitate the patient in a timely manner. Say a patient, in this patient, where I am telling, he has a problem with his airway. So somebody has to control his airway. So give the fluids, that is the best place, because we are known worldwide for the emergency care. And that care is only possible in emergency department.
Okay. So you receive, stabilize and manage.
Yes, exactly.
Okay. So now tell me, what is the first thing that happens when a patient comes to emergency department?
So emergency will always be into two parts. One is a triaging system and then into the emergency department. So you may ask me, what is triage? It's nothing but sorting out of the patients based on the requirement who come into the emergency department. So in our emergency in Narayana Hrudayalaya, we have 5. That is immediate. That means that if there is a life-threatening illness where you have to see and save a patient. Urgent, where it is imminent that this patient can go in for some life-threatening illness. So that is urgent. The third part is some of the people can have like an acute pain abdomen, but they're not requiring any life-threatening illness. That is a third part. Fourth is they go into something called as a less urgent, but has to be seen. Last one is the walk-in patients. So you divide this into 5 categories.
So based on the severity of their illness. Okay. So this is actually ESI or Emergency Severity Index, which is used actually worldwide.
Yes. Emergency Severity Index, ESI, as you rightly mentioned. So the patient will be getting into the emergency, will be looking into them, looking into their vitals, like look into their consciousness, respiratory rate, and also saturation and the pulse rate. Only with these 4 things you can triage these patients, as I mentioned you, into these 5 categories.
Okay. So what about the waiting period in emergency room?
That's a very good question, because we all know that emergency will not come by asking. It can happen to anybody. A person can be walking, he may fall down, but brought into emergency departments. So as per the last question what you asked about the triaging system, so based on that these patients are categorized and kept there. So the most important patient is the immediately requiring attention. So those are the patients who will be treated first, and then the walk-in patients will be seen. So it will be like a second or within a minutes.
Okay.
That's how.
Okay, so level 1 and 2 will be prioritized more than 3, 4,
3,
5.
4, 5. Yes,
Okay.
yes.
So probably sometimes like 4 and 5 may have to wait.
Wait for it some time.
But yet we try to reach.
Yeah, correct. Correct.
Okay. And what about waiting for test reports or any CT or MRI reports?
So once a doctor sees the patients, he will order for tests, relevant tests. And then sometimes you say a stroke patient. So they will be requiring what? They require a CT scan. So a CT scan will be taken. Or if a patient has come with some kind of a meningitis or some other illness, you may order for an MRI scan. Based on this, usually it's an urgent care system. So the reports will usually come within an hour or a 1.5 hour based on the time limit. And it depends upon hospital to hospital and the categorization as we mentioned in the previous period.
So which is more emergency will get prioritized over those which can wait.
Yes.
Okay.
Yes.
Okay. And what can they expect when they are getting discharged?
So once a patient is seen in the emergency department, you have diagnosed the patient, this particular illness is there. So either the patient will be admitted or the patient will be discharged. It can be either to operation theatre or to ICU or to ward or to semi-dependent ICU. So these are the places where the patient gets admitted. If any patient doesn't require further care and he has been treated and the patient is satisfied with the treatment, he'll be discharged. So when he is getting discharged, we will give him a proper discharge summary where everything will be written what has been done in the emergency department, and all the relevant investigations what has been done for him will be handed over a copy to him. So this is what is a protocol which has been worldwide followed, and the same system is brought into Narayana Hrudyalaya.
And along with that follow-up, advice on follow-up, where to follow up or when to follow up.
Yeah. So they can look into the whole discharge summary where it will be mentioned that these are the relevant investigations done. This is the diagnosis, and then what is the treatment medications on discharge advice, and when they are supposed to come back and whom they have to meet.
Okay. Now, what do you expect from the patients when they come to emergency department?
A little bit of courteousness towards the doctors, nurses and paramedics in the emergency department, because we are healthcare providers, we are here to care for the patient. And at the same time, what happens is we get a lot of patients into the emergency department. And as per the triaging protocol, as mentioned by you and me, so we see the urgent care patients first, and the patients who are walk-in should wait. So the same thing, the patient who comes in as a walk-in should be courteous towards the doctor and the nurse, wait for some time for his turn to become and seen by the doctor.
And also give relevant medical information, any allergies or if whatever list of medications they're taking. So it will help us in management of the patient.
Rightly said. You have rightly said. You have put forth what I really missed it out. That is the medication list. Past history is very, very important, because a patient coming in with unconsciousness, the doctor will not be knowing in the emergency department. He will be dependent on the patient attenders to get all the details, submit to the emergency department doctor, so that he will be able to see it and give the right treatment at the right time.
Okay, I think we would have cleared a lot of doubts about what to expect when anybody comes to emergency department. What do you say, sir?
Yes, 100% agreed.
Okay, thank you.
Thank you very much, Dr. Reshma. It was very nice speaking to you.
Thank you.
And hope this video will be helpful for all the patients who are visiting the emergency departments.
Yes, sir. Hopefully. Thank you.
Thank you.